Hello and welcome to this video. What we're going to be doing in this video is we're going to be discussing some of the muscles that hold the shoulder blade on to the body. Some of them we may talk about, but we're not going to really discuss because we're going to get into those into other videos. So the first muscle I really want to talk to is this one and talk about is this one right here, Pec Minor. OMG, you guys, this muscle is one of those muscles that we all know about and we all talk about, but so many people just glance over. This muscle is going to do a little bit of the medial there. It's going to do medial rotate, not medial rotation. It's going to do protraction of the shoulder blade. See, I'm going to get there at some point. So it's going to do protraction of the shoulder blade. And then it's also going to do a little bit of shoulder depression. This muscle will contribute when there is medial rotation of the shoulder. So we see that medial rotation of the shoulder. What then happens is the shoulder blade tends to protract just a little bit. And that protraction looks kind of like this. If I can get to pull up, there it goes. So there's that protraction. The shoulder does not have to come out. The arm does not have to come out like that to have that protraction. You can pull your shoulder blade out just with your arm down. And so many people live in that space right there that this muscle is activated and it's constantly activated. So it attaches up here at this coracoid process of the scapula, and it goes down to the third, fourth, and fifth rib. Typically, the nipple is like right here, right at that that middle origin of the Pec Minor. This is we forget about this because we have the Pec Major on top of it, which can definitely be an issue. And this muscle is just a little bit more difficult to get to, especially with women or with people who just are very sensitive. So pin and stretch is a really good technique that you can use to work with this Pec Minor muscle. All right, so the next one we're going to address is a little bit more difficult to see. Let's see, I can actually hide all. Ooh, I don't want to hide all of it. I want here, isolate. That's what I want. Isolate. Serratus anterior. Now, serratus anterior is going to do the same basic thing as the Pec Minor, because this muscle, we have the subscapularis right here that's going to be in between the scapula and the serratus anterior. This muscle is so underworked because there's so many therapists who believe that the back stops like right here. And they very rarely do I have anybody who grips over into the rib cage. And I think that's because we think, oh, well, I'm going to get too far into breast tissue. But this muscle is so worked and never worked on that it becomes very stressed. So we end up with a lot of different issues in this muscle, a lot of trigger points and things like that. So we're going to look at this motion. So this is going to be that protraction, again, of the shoulder blade. See, and then that pulls forward just like that Pec Minor. So they work in sync with one another. They're symbiotic muscles. So definitely would look into doing that. I just recently experienced cupping on my serratus anterior, and holy crap, it was not necessarily painful, but it was one of those, like, I'm not used to that sensation. But after the cupping work was done, I felt actually like relief. I work this muscle quite a bit, especially with those people with asthma, because it is sitting right on that rib cage. People who have tension in the back, in the chest, this muscle is a lot of it to blame, especially if they're really medially rotated and that upper cross syndrome is happening where all of the chest is tight. This muscle is one of the culprits that is really beneficial for us to work on as massage therapists. All right. All right, so the next muscle that we're going to look at is we're going to look at one of those intertubercular groove muscles that I talked about in the last, or in one of the other videos. We're going to talk here about this. If I can get to, there you go. This is your teres major muscle. It's going to go from the inferior angle, like the very, very inferior part of that infraspinous fossa, inferior angle lateral border of the scapula, and it's going to go all the way out here to that intertubercular groove down here onto the side. So if we isolate that muscle, this is what that looks like. So it goes from down here and then all the way over. This is going to do medial rotation because it's going on this side of the joint. It's going to pull, and when it pulls, this shoulder joint is going to medially rotate. So we can actually look at that motion here, where this is going to do a lot of medial rotation. It's going to do a little bit of extension or hyperextension of the shoulder, a little bit of adduction, but the big thing that this one does is going to be medial rotation. Come on, pull up. There you go. All right, so let's fade all so we can see this muscle at work. So boom, see how that kind of makes that rotation happen. Because it is on this side of the joint, it is going to do that adduction, and it's also going to be pulling back because if we look on the lateral side, we can see it goes backwards. So we have that teres major muscle. The next muscle we're going to actually, I'm going to do upper limb. There you go. So the next muscles that we're going to have two more muscles that we're going to be addressing in this video. We have deltoid and we have pec major. Both of these are really, really large muscles. We are going to address deltoid first. The deltoid actually has three different heads to it. It has the acromial head or the middle head. We have the clavicular head here. This is going to be, or the anterior head. And then we have the scapular head or the posterior head. It really all just depends on which anatomy textbook you read. Each one of these muscle fibers, it's one big muscle, but each muscle fiber is going to do something slightly different. So we'll start here on the scapular head because that's where I'm at. This is going to go, this is on the lateral 1/3 of, or the spine of the scapula. Some textbooks will say lateral 1/3 of the spine of the scapula. This drawing has it a little bit farther back. I find it doesn't really matter as long as you know it is on that spine of the scapula. And then it goes down and there's the deltoid tuberosity. So like, let's see if I can isolate this. So we isolate this, the deltoid muscle. So that's the one big muscle. It all comes down here, deltoid tuberosity on the humerus. And then this one is, this muscle is actually going to be pulling posteriorly. So you'll see a little bit of lateral rotation because it is at that angle, that side angle, and it comes out here to that lateral humerus. So you'll see a little bit of lateral rotation. It's going to do extension, hyperextension of the shoulder. Then you cut, like, there's a lot of trigger points that you find in here as well. So let's see. Oh, I have to not isolate anymore. All right, then we have this middle one. This is going to do a lot of abduction. This is the main abductor for the shoulder. So you're going to see a lot of that movement out and then back in. This is going to attach up here at the acromion and all the way around that acromion, from the spine of the scapula, acromion, all the way to the clavicle. A lot of people will experience knots, especially in the front part of this, like closer to the AC joint, there's a lot of trigger points and things that occur here that can cause pain all the way down the arm into the thumb and pinky. So you want to be very aware that if they're having maybe issues with their thumb, it could be happening up here, could be caused from up here. But trigger points in the in the deltoid are very, very, very common. And then you have the anterior part, or the clavicular head, and this one is going to do a little bit of medial rotation, and then it's going to assist with flexion of the arm, of that shoulder joint. So huge muscle here, deltoid. All of it attaches down here at the humerus. All right, next and last muscle for this video is we have the pectoralis muscle. This is the pec major. Now with the pec major, I love how they like break everything else into heads, but the pec major that they don't. So I'm going to see if I can isolate this one. So pec major, this is a huge one. Now if you have anybody who's had like breast augmentation, a lot of times, now this, it doesn't happen all the time, but a lot of times they will actually go in underneath the pec and put the stuff underneath the pec. At least that's the last thing I heard. The pec is actually like a natural brassiere, and it will hold things in place a little bit. So be very careful. Anybody who has had breast augmentation, they may have really tight pecs. I don't know if they've changed that. I will say that information is probably about 10 years old. So, all right. So with pecs, I'm actually going to click off of the pecs because I want to be able to draw on this. Let's see if I can do this, and then we will, dang it, I keep clicking the wrong button. Okay, isolate. So I'm going to grab my nifty tool, and then we're going to talk about the different fibers. So we have fibers. We have this clavicular fibers up here, and then let's change color to orange. Actually, let's do blue because it's a different color. We have blue. We have the sternal fibers here. Yeah, the sternal fibers, and those will actually go a little bit. I'm really crappy at this. I'm sorry, guys. Those will go up here a little bit more. That's okay. This is terrible. Okay, I'm gonna have to. I'm sorry. I'm really not good at drawing with my mouse. So you have the sternal fibers. Let's see if I can get this now. Sternal fibers are here. Now they kind of go and tuck underneath the clavicular fibers, and then you have these fibers, and these fibers attach down into the tendons for the rectus abdomini and onto the rib cage a little bit. So all of these fibers, they're going to work slightly differently, but we're going to feel a difference in where they connect and how they function. So let's hit this undo button a couple times. Did it do it? Yay, I don't want the pen anymore. All right. So this muscle is a huge muscle. And if we look underneath it, we have the pec minor. This is the one like you can get into and kind of grab yourself off to the side, get in your underarm. The motion of this, there's a ton of them. So this is going to help with a deduction of a transverse shoulder. So this is where the arm is out straight and it's going to pull it in. So if like, I don't know if y'all have ever done this, but like the seal clap where you put your arms out in front of you and you just clap your hands with your elbows straight. This muscle is the one that does that. It does do medial rotation of the arm. Excuse me. See if it actually, come on. It doesn't, it's not responding to me right now. So there you go. Medial rotation. It's also going to help with shoulder flexion. So this muscle is going to bring the shoulder or the arm up. It's working. It's thinking. It doesn't want to think. There you go. So that is actually shoulder flexion, where you are getting all the way up like that. So that is shoulder flexion, and this muscle is really working there. And then shoulder adduction. So this is going to be where we add the arm back into the body. So this is going to be from like we're flapping our wings, and then back down. So stretch. Yeah. And this is the arm completely out to the side, not out in the front at all. So again, very large muscle. We forget a lot about like what we're doing. Sometimes we forget about this muscle and how much it actually does work. So those are the muscles of the shoulder. The next class, we're going to be talking about the shoulders of the arms. So we're going to only have a few muscles, so a little bit shorter video, and then we'll get into the muscles of the forearm and hands, and then you shall be done with this portion of the anatomy class. So again, review these muscles, see if you can palpate them on yourself, and we'll see you next video.